Not only do I love this case because of the result, but I love it because of the challenge. I'm sure most dentists would not want to touch this case and say it's a veneer case, but let's get into it and I'll show you why it is. What are we looking at over here? Grinding teeth. She just has the habit of sliding side to side. You can just see that all of these indents that she has on these teeth is because the lower teeth have just been sliding up and down, left and right on these teeth, and she's just going back and forth. And a dentist in the past was like, oh, you don't like your two front teeth? No problem, let's just put a little bit of bonding here. Maybe that'll last, maybe it won't. And clearly you can see it didn't. So what's needed? I'm gonna walk you through the preparations and the final result. And you might think, wow, how much did you have to shave for this case? Believe it or not, the patient did most of the shaving for us. So in this smile, what you're seeing is that the length of these two front teeth is actually where I want the smile to be. So the dentist that put the bonding on didn't do a bad job. It just didn't have supporting actors in the bite in order to help the patient protect it. It's called occlusal forces. When you slide left and right, you need to make sure that you have canine guidance. The importance of canine guidance, which I speak to all my patients about, is as you slide left and as you slide right in your jaw, you need to make sure that the canines are disoccluding or not allowing any of the other teeth to touch. And if you're doing that as you go left and right, that's where losing the canine guidance leads to just complete breakage and fracturing of the smile. And so in this case, in order to do this correct, you have to reestablish canine guidance and reinforce the value and the importance of wearing retainers and night guards to protect the smile and the investment. So I knew that we were going to build the smile basically to the length of the front teeth. So if you think about it, how much do you actually have to shave? Do I need to shorten these side teeth all that much if I know that I'm trying to create length? And on the bottom, you know, she did a lot of the shaving. Obviously we need enough porcelain space in there, but you really wanting to add length because once upon a time she had length in these teeth. So my goal here is trying to reestablish what the patients once had. So you can see, yes, I removed the bonding, I removed different things, the decay that was here. The canines were flat. Basically, I didn't need to make them that much shorter. But if we're looking on comparison of this two, where there's bonding here, there's bonding here, there's bonding all around here. If now you take all of those bonded areas of her case out and you're looking, what you're just seeing is the same thing, just everything's a little smoother, everything's a little softer, everything's a little bit more delicate. So now when we bond the porcelain to it, we have strong tooth, a lot of enamel, and that's where you get the strength. It's not in prepping these teeth into little triangles and then slapping on porcelain or zirconia, which patients are like, are you gonna use zirconia? It's the strongest. I'm like, I don't know if zirconia crown is actually stronger than your own natural tooth, right? So maintaining the strength of your original natural tooth is way more important than trying to make these teeth into triangle and adding crowns on there. So then the next other important thing is making sure that the outcome of the teeth, of the veneers, looks the same. So we always talk about taking shade photos. The teeth in her smile are all the same aside from that one tooth. So my ceramist needs to know exactly what the colors are so that we can mask it and the end result is going to look uniform and you won't know that that single tooth was a little bit darker. That's just for me and her to know, right? And so here you can see the porcelain on the model. We're creating canines to be nice and sharp. Those original two teeth were in the same length as we talked about before. You can see the beauty, the texture, the translucency. If we just made thick porcelain, you wouldn't have this beautiful element in the porcelain, unfortunately, because there has to be a lot of building up of material to get here. So as you can see from the back, it's crazy to think about it, but there's still a tremendous amount of tooth intact. And then what you're seeing over here is a communication between the ceramist and I where I'm like, hey, I've mounted the case. I see that you need a little bit more space between the lower and upper tooth. So can you just, upon delivery, just do a little bit of reduction there? I love it. We communicate so much. I think it is critically important to make sure that the person that you're working with understands your capabilities, understands your vision, and can get you the result. So rather than making the lower teeth smaller and saying, oh, I don't think there's room for it, hey, can you reduce about 0.5 millimeter so I can get that canine into the places that I want them, so those points of the canines can slide along the upper canines nicely. And so as well, the same thing on the back of the lower teeth, protecting those lower teeth from having to grind them away. 3 years later, this is what her smile looks like. This is what her teeth look like. No chipping, everything's healthy, very compliant patient, really important. And you can see from the side view where all of the teeth that we put in, this is just, porcelain is staying the same. There's no fractures in the porcelain. There's no compromising in the porcelain. She's just now a really happy patient that she went with this approach versus having to shave a lot of her tooth. And so this is where we started. That's where we finished. This again is where we started. And this is a 3-year outcome of transformative, healthy, long-lasting dentistry that I am proud of doing, and I'm very happy for our patients to be trusting what we do every single day.